Hello, welcome everybody to the Greeley Healthcare Podcast. That's really dealing this in this environment with our COVID-19 crisis. We just want to bring you some information from Greeley that keeps you up to date on some of the things that are happening in the regulatory environment. My name is Lisa Eddy, and I'm a registered nurse and the advisory consultant for the compliance practice. We'll be focusing today on some new information that is COVID-19 related, really, to disaster privileging for the medical staff. I have the good fortune to have Frances Ponsioen with us today, and she is the consultant and senior director of the Greeley Credence units. Frances is certified through the National Association of Medical Staff Services, NAMS, in professional medical services management provider, and also is a certified provider in credentialing specialist. So I'm really glad to have Frances with us here today. We've had a number of inquiries on the compliance side from clients about various issues that they're having in relationship to credentialing and privileging during the crisis. So I think it would be really good to have Frances's input. So Frances, the Joint Commission came out recently with a discussion on extending provider reappointment timeframes. Can you help me understand, because I'm on the compliance side, and I rely on you guys heavily for this provider information. Can you help me understand the extension provided and the reason that this has been allowed by the Joint Commission?
Yes, thank you, Lisa, for inviting me to be part of this podcast today. So yes, very interesting. I will say in my 25 plus years of being a medical staff professional, I have never seen this allowance by Joint Commission for the extension of reappointments or reprivileging. But there's some very specific criteria that has to be met in order for this to be allowed. And recently, Joint Commission published on their FAQs that they will allow for an extension of the reappointment or reprivileging beyond the 2-year period if the following circumstances are met. And the first, obviously, is a national emergency has officially been declared, an organization has activated its emergency management plan, and then another very important one is that it is not prohibited by the state law to extend the duration of the provider's privileges during an emergency. If all three of those are met, and you have providers that their reappointment reprivileging date will expire as a result of what's going on, that extension of their reappointment is an automatic and is allowed. Another key piece here is
Go ahead.
Another key piece here is that once everything's ended, then the organization is going to have 60 days to bring those reappointments current. So that's very key in this. There's a 60-day period that is allowed. As far as the time frame where this extension is allowed, of course, that is dependent on the national emergency. So it could go on for quite some time.
Thanks for that, Frances. So this is an interesting dynamic. How would you tell our clients, what would be your recommendations for successfully implementing this, considering, reappointment cycles, and think there's a lot of kind of moving parts to that. So what are your suggestions for implementation?
So the allowance of the extension, honestly, is pretty straightforward. I mean, it's an automatic, it will happen. You can automatically just allow that extension to happen. Reappointment cycles vary across organizations. You see organizations that have reappointments set up on a monthly basis. So every month they're processing reappointments, having them presented to the appropriate committees with the board approval. In some organizations, it's quarterly. And I've also seen some organizations where they do it once a year in bulk. So it's very dependent on the schedule. What I'd like to try to give you an example of is that if you have an organization that is working on a monthly basis, we have reappointments, I'll just use a date of May. We have reappointments coming up, they're due May, they have to be reappointed and approved by the end of May. Most organizations are working between 4 to 6 months in advance of that reappointment. So they very well have sent out their reappointments as early as November for a May reappointment date. So between November and now, those reappointments that have already been sent out, hopefully majority of them have been coming in, and the medical staff office has been working on those reappointments. The crisis or the challenge, I'll say, that they may be faced with this month as they try to get those to committee or department chair review is that their medical staff leadership isn't available to them because they are dealing with other things that are obviously more important. So many meetings are being canceled. Leadership is just not available to you. So that's where this extension is going to be most helpful to those organizations. They've actually received the reappointment, they've processed it appropriately, and because of meetings and just availability of leadership, they now need to implement that extension, and essentially that reappointment gets put on hold until the emergency is over. That same scenario would apply regardless of the cycle that you're under. It's really what is due during this month and months forward and how those reappointments will be impacted. It's very important, though, that as you approach this, you think very strategically about it as best as you can, because any reappointment that's put on hold, remember, you will have to bring it current and you'll only have 60 days to do it. So depending on the volume, depending on how long this lasts, you really have to think through this if you want to implement this automatic extension.
Okay, well, that's going to be interesting for our medical staff services folks. One of the things that I had a client ask me, and I was going to ask you, so I'm glad that we had this opportunity. How do you think this should be communicated, or do you think it should be communicated to providers, and then how should it be communicated to medical staff offices? So I don't know that everybody has this information. Most people do if they're getting the Joint Commission updates, but how do you think there should be sort of information disseminated about this particular provision?
Well, again, I would be cautious in how we approach this, and even more importantly, how we communicate this. Because unfortunately, there will be medical staff members and leaders, quite honestly, that may take advantage of this ability to extend the reappointments and essentially just stop everything during this emergency crisis. The likelihood of medical staff members hearing about this and knowing that it's available, I'd be surprised, to be honest. But, obviously they very well will know about it. If they know about it, they will decide, because they can, to just not complete their reappointment application or not get the reappointment back to the department timely so that it could be processed. That's the last thing we want to happen. We don't want everything to just stop. If, really this allowance of the extension is to give us that time where it's absolutely necessary. So I wouldn't recommend that we just stop everything we're doing in the medical staff office and send out a blast communication that all reappointments are put on hold, because again, once this is over, now you're faced with how do you catch up? How do you bring everything current? And that right there is the bigger risk, because of the short amount of time you have to complete and bring those reappointments current. And if your volume is high, because this went on for some time, or just the volume that you traditionally have for your reappointment cycles is high, you're going to have quite a bit of work to catch up on, in addition to the day-to-day work that has to continue and reappointments that are on cycle after the crisis is over. So communicating out, I'd be careful. If you're in a position where you absolutely have to, because that's just the circumstances of your organization, and you know that things have stopped. I'll just use an example of New York City. My guess is that reappointments are not a priority right now. So therefore, they may be sending out some communication to their medical staff and letting them know, kind of removing the worry or the angst that their appointment may expire as a result of all this going on. Therefore, the communication is warranted. Let them know that, you're been given this allowance by Joint Commission. We're going to kind of put everything on hold, but know that once the emergency is over, we will need everyone to be responsive and ensure that you get the reappointments back, and we will proceed with those reappointments in the time allowed by Joint Commission of 60 days to bring everybody current. So it very well may be needed. But again, I would caution taking that approach if it's not absolutely necessary.
Okay, that's some very good insight, Frances. I appreciate that. So how do you think this should be documented? Meaning, if you're going to trigger this, right, you're going to allow your staff to do this, how do you think this should be documented in terms of the medical staff services folks? How should they capture this? Should they, I don't know if they do this, put it in a policy, but should it be in a guideline? Would it be in the medical staff minutes? Would it be, should it be approved, obviously, I think, through credentialing, MEC, and the governing board, or strict just up through the board? Because, board has the responsibility to approve all the credentialing and privileging. But what's your recommendation for how, if an organization is going to use this, it should be captured? So when we have that look back after everything's over, we can, follow the through line of how we went through this in a very thoughtful, systematic manner.
Absolutely. So you absolutely need to document. I think that's so important right now because it is in unusual circumstances. And I always like to recommend documentation specifically because of we might not remember 2 years from now exactly what was going on or what the time frames were or who the physicians were, providers were that were impacted by this. So that documentation is going to be very important. Don't necessarily think that it needs to be a formal policy, but absolutely a guideline, really using the language and the rules that Joint Commission has allowed within that guideline. But more importantly, when was that guideline effective? At what point did you say, is it April 1? Is it May? Depending on what those reappointments are being affected, which month is affected, that's when you would want to ensure that that date is documented within that guideline. And yes, again, depending on your availability of leadership, very well needs to go all the way up to the board or maybe just straight to the board for them to bless it, to approve it, to say, yes, we recognize this, and yes, this is allowed, and reappointments this point forward will be given this extension during this time of emergency. I also would recommend that in addition to that guideline, it's going to be important to track or have a really good tracking process of which reappointments, which providers are affected by this. So an attached roster, something that will give you the names of every provider that you will need to address once the emergency is over. And those reappointments may be in various stages. Like I said, if you're currently working reappointments that are due in the coming month of May or beyond, and those reappointments stop, you can't just take them straight through. Remember, there's going to be things you're going to have to do. You're going to have to bring them current. You're going to have to make sure that that license verification is current. You very well may have to run the data bank depending on how long of a time frame we're in and your organization is under its emergency plan. So there's things you're going to have to do. So you're going to have a roster, a running list of those providers that you're going to have to address once it's done. Ideally, that should be part of that approved agreement guideline that your governing board has provided you.
Thanks for that, Frances. So you answered a question that I was going to ask you. Meaning, we want, when any organization is going to have variances or be out of compliance with the conditions of participation or any of your accrediting regulations, such as this would make you if you went beyond your reappointment cycle. We do want to make sure that we do the right things. In some cases, we get a waiver from CMS, but we do the right things, such as when we tripped the wire, so to speak, when we actually started this revised process. And so Frances mentioned that you want to very clearly document when you start. And then we know for this instance, it's very clear, Joint Commission has said you have 60 days past the end date when the national emergency was invoked by the President of the United States and the Secretary of HSS. When they revoke that national disaster and say the national disaster is over, then that 60-day timeline starts. So we encourage individuals to understand that not just for this, but for anything else that they are going outside of the guidelines for either the COPs or your accrediting agency, that you have a start and stop date, so to speak, built into what you're doing. And then I do want to mention something, Frances, before I get to my last question for you. And what I want to mention to our clients is, over here on the compliance side, I'm dealing with a lot of individuals that are experiencing the same thing that Frances is talking about for medical staff providers, for other clinicians, nurses, respiratory therapists, social workers, individuals that are being called up and in to work in hospitals, and that volunteers and so forth. There is a parallel allowance in the conditions of participation from CMS right now that is allowing volunteers and other individuals to sort of function in different sort of functioning outside the regular rules of what we have in place in healthcare. So we want to make sure that we understand that that's happening, not just with the physician staff, but with all clinicians. And then, so Frances, my last question for you really is, we know how medical staffs work, and you alluded to the fact that, sometimes physicians don't think that getting their reappointment application done, they have to do it every 2 years. It's a big pain in the neck for them. And so, it's not the thing that they decide, hey, today I'm going to sit down and do my reappointment. So I imagine there's, along with all of the spinning plates that go into a reappointment application and processing, what would you anticipate the unintended consequence of this particular allowance to be on medical staff offices? And then sort of including when what would the unintended consequences be now while they're implementing this? And then what are the unintended consequences perhaps that you can think of when the national emergency is over?
I think the unintended consequences of implementing this is that where there was an opportunity to still work some reappointment applications filed, everything just suddenly stops. If you just put a blanket, we're going to stop, we're not going to do anything, we're just going to let this ride out, and once it's over, then we'll do everything. I think, unfortunately, if by doing that, medical staff offices would lose the opportunity to process at least some of them that are responsive, some of them that can get through the committee review, either in person or electronically or virtually, versus just stopping everything and having it happen at the end when everything's over. Because when this crisis is over and we now have 60 days to bring everything current and compliant, has the potential to be, quite honestly, a bit of a mess. Because, again, depending on your volume, you will have to address those particular files. It could be 100, it could be 1,000. In addition, the day-to-day operations of the department and any reappointments due after the crisis that do not have this allowance of an extension have to be processed and done timely in order to meet the compliant requirements. So it's a lot of work that medical staff offices may not be anticipating if they don't set it up in a very strategic way. So to just kind of stop would not be the best recommendation. I think you still have to work them, those that you can, where it's absolutely you can't move it forward for various reasons. And the reasons of not getting a reappointment might not just fall on the applicant, might not just fall on leadership. But if you have requirements within your own organization of verifying 100% of hospital affiliations, well, maybe those hospitals can't reply because they are in the midst of the crisis. Maybe the peer references that have been listed can't reply because they are in the midst of the crisis. So there's so many different reasons why you might not be able to get that reappointment through. But by just completely stopping, I think we're missing an opportunity to at least work some of them or some of the process so that when it gets to the end and when this does end, there's less work that has to be done versus the entire packet, the entire process for potentially 1,000 reappointments in addition to those that are already on the schedule after the crisis. So you really have to think strategically. I mean, Again, most organizations are working 4 to 6 months out. So you still have to be working 4 to 6 months out, anticipating that this is going to end. You can't just stop because of this extension.
Well, thank you, Frances. I really do appreciate you spending the time with us today, and I want to thank our listeners as well. I do want to point out that there's a model policy that sort of gives us this waiver, if you will, for this temporary situation. Yeah. And again, policy guideline, whatever you want to call it. I'm not always in favor of a hard policy, but you might have a guideline. You can also discuss this in your medical staff MEC minutes going up to the board. We, as Frances mentioned, we do want to get board approval because they have the ultimate oversight. But I just wanted to thank you so much, Frances. I know you're super busy with everything going on. I do want to point our listeners to another podcast that we've recently completed with Dr. Mary Hoppe regarding COVID-19 considerations for hospital medical staffs. And Dr. Hoppe and actually Dr. Rick Sheff had a conversation about some of the things that are being challenging within the hospital medical staffs right now. And I think disaster privileging is touched on, not as deeply and as thoroughly, I believe, as this particular podcast, but folks might want to take a listen to that. It's very informative. So I would refer all of our listeners to our website, Greeley.com, for information on what's sort of happening out there right now and the various recommendations we have on compliance and the medical staff side for managing some of the COVID-19 situations. Again, that's Greeley.com, GREELEY.com. And thanks again, everybody, for your time today.
Thank you, Lisa. I appreciate it.
You bet.